Namaste everyone, my name is Paulomi and I'm here to talk about the series, the second topic. And today we're going to tap a little bit on conception and fertility. Okay, the process of conception, how does it take place? Ovulation. Okay, ovulation followed by hormonal levels that change. The egg travels to the fallopian tubes. If the egg gets fertilized, pregnancy takes place, which creates further changes in the mother's body. And either a home test determines it, which is through urine, or a blood test, or even a scan to confirm the position of the pregnancy. Okay, where has the baby been implanted in the pregnancy? So scans are done to detect that also. So these are the factors which lead to conception. All right. Moving forward, let us understand, certain fun facts and certain things which actually take place in the body. One, women are born with certain number of eggs. Okay, so if you plan on putting your pregnancy on hold, or if you plan to, have it 1-2 years later, or for whatever reasons, have a word with your physician. Just get a test done to understand the number of eggs you have, and how much can you wait. Okay, so women are born with those number of eggs, and what happens is we share this. This is a fun fact. We share this special connection with our nannies, that is our maternal grandmothers. And how? So when a mother is pregnant, let's say she's pregnant with a girl child. That girl child obviously has eggs, okay, because you're born with those many eggs. So technically, this girl child who's carrying eggs, who is like a supposedly future mother, is holding her future child in her already, right? Because we've got fertilized from eggs only. So that way, we were inside our nannies or our maternal grandmothers before. So that's a special connection, isn't it? So that's a fun fact I thought I should share. Other than that, let's move on to the next part. So yeah, when eggs don't get fertilized, when the whole process, when they don't get fertilized, there is menstruation that takes place. So periods, that's what we call it in layperson's language. I hope whatever we discussed today, I would like to make it very, very simple. I don't wish to use technical jargons. I want anybody and everybody to benefit from it in the first place, whoever is, watching it. So next one will be factors which affect our conception. First, age. I hate to kind of bring this topic, but age does play a role. It's like how our organs tend to get older as we age. Okay. Similarly, the quality of eggs, the quality of sperms also get affected as we age. All right. I'm not encouraging that, no, in your 20s, no matter what, go get pregnant and get married or etc. I'm not saying that. I'm just saying that just be mindful and aware of these factors. Earlier, the pregnancy used to happen in teens, which is not advisable. 20s is a good time. Late 20s, again, very good. Right now, it is observed globally, and I'm not again propagating anything per se. After 35, for women especially, the quality of eggs starts to deteriorate a little. Okay, by deterioration, I'm not saying that on the 35th birthday and after that it will start to decline. No, around that time, 35 plus and so on. And by the time women reach 40, it is observed that conception becomes a little difficult. Okay, I'm not again encouraging go early. Do get pregnant when you want to get pregnant, but these are just certain factors that you need to keep in mind, especially when you're trying for the first time. Okay. So coming to the age factor, and same thing happens with males also. As they age, the quality of sperm also starts to decline, and even the mobility of the sperm also starts to decline. Okay, so these factors do play a role. So accordingly, plan on pregnancy. Accordingly, think about it. Then comes the second part, which is your health. So even if, let's say, you're in your 20s and your health is not fine, it is going to affect conception. Okay, your health could be if you have certain health issues already, if you already are on certain medications, or if you're just unfit or just too underweight, too overweight, it is going to affect conception. So your overall health, and of course the mental factor, if you are very stressed, you are burnt out, you have a lot of things to do and you're very worked up, it is going to affect your conception. So age, mental and physical health both, and then comes the lifestyle, which impacts these. So if your lifestyle is something where you're smoking very regularly, you are into a lot of drinking, recreational drugs, or you have a lot of caffeine, or you're not eating very healthy, or it is going to create an impact on your health, which in turn is going to affect your conception. Okay. Moving on to the next one, wherein sometimes couples are not able to sync their intercourse with the period of ovulation. So intercourse during syncing it with ovulation and syncing it with the time where chances of pregnancy is better is what determines your conception ratio. But if you're not going to engage in intercourse around that time, conception will not happen. So many a times, because of lack of time or lack of information on something like this, usually that doesn't happen, but lack of information on something like this, it can start affecting, okay? Because ovulation cycle is not clear, the period cycle, 28 days, 30 days, 35 days, depending from person to person is not clear, it does create an impact. So these are the basic factors that take place. Now let's talk about certain health conditions which actually impact conception. One, ovulation issues. If the to-be mother, the woman, has certain health issues already, where she's not ovulating properly, or where she doesn't know when she's ovulating, the cycles are not very, what do you say, in sync, it's not regular, is when conception is going to get impacted. Okay. Other area is certain tubal factors. Tubal factors could be, we have fallopian tubes, if there are any blockages or certain difficulties, issues with that, again, conception is going to be impacted. Uterine issues. If now uterine issues, again, they are not very, very common, but they are not very, very alien also to people. If there is difficulties in the shape, or if there is any problem with the position, or if the internal lining is affected, it is going to create difficulties in conception for couples. Okay. So uterine factor, tubal factor, ovulation factors, and of course comes to the sperms. If the sperm count is low, if the mobility of the sperm is also not, mobility as in the speed at which it goes in is not good enough, it can hamper the process of conception. Now with all these factors comes certain dysfunctions. So if there's a dysfunction for a male or for a woman, where they are not able to have penetrative sex, obviously conception is going to get affected. So these are certain health related issues, and then comes, when all these factors are not applicable, comes this factor of unexplained infertility. Now this factor of unexplained infertility is on the rise definitely, wherein couples are fine, there is no medical issue per se, but still conception isn't taking place. Now what happens is, when people are in their late 20s and they're not conceiving for, let's say, a year or so, doctors ask them to wait it out and try for a longer period, that try for another year, things like that. If you are in your 30s, usually the window will be like, I'm talking about below 35, okay, early 30s. So usually the window will be like a year, that if you've been trying for a year, if it's not working, then we'll take a test. Provided there are no other health conditions, alright? But if, especially the mother, if they've crossed 35, the couple, it's recommended that if 6 months of trying and there is no conception that has taken place, is when tests are recommended. Now this is majorly applicable during the first pregnancy. If there's a second pregnancy, usually people say, okay, go slow, chill, you've been pregnant once, it's okay if you just take your time, that kind of a thing. But for first pregnancy, usually these are the sort of guidelines that medical practitioners follow. Now with this comes to the part where what can we do to support ourselves. One is when there is, let's say, unexplained infertility, or when we say there is, things are just not working out, it's been a year since we are trying, and so on and so forth, there are no other complications. Then you start focusing on probably your stress levels. Start focusing on your lifestyle. It is so crucial to understand if we are making some mistakes in our lifestyle, if we have this burnout, if we are very worked up and stressed, or if we are, emotionally just not fine, if there are other physical, parameters which are not interfering, then what? We need to explore these areas. So probably if you feel the atmosphere at home is very stressful, go for a baby moon, just make a trip. Monitor when the ovulation is. Okay, there are ovulation kits. You can always determine your ovulation period. You can always determine you can understand your cycles better, basically. And of course, the equation between partners. Okay, the equation between partners really matters. So if, let's say, somebody in their 30s, and let's say you are newly married and want to have children, don't just have children because you're in your 30s and you want to have children. Ensure that you are in a good sync, you're in a good rapport with each other, and you're ready to co-parent. That is when you go for it, right? So ensure these factors are also taken care of before you just start trying and planning. So these factors, and then comes the factor where nature needs assistance. Sometimes nature will need assistance when things are not going in a very regular way. We have to create some interventions, and we need to work on it then. So one is this, movies have shown this turkey baster method. It's turkey baster method is where the mother who will take a donor sperm and she will inject it by herself in her vagina. They are not using the turkey baster tube literally, but it's called turkey baster, and it's ideally not very advisable. It should be done under supervision because it can give a lot of infections and so on. So that is one thing. So during the right period, sperms are injected. That's what they do. There are better methods than that. One is, like I said, ovulation kit. Try to figure out, understand when your chances of getting pregnant really high. Then comes this part of IUI. IUI is something which is a way in which people can get support and help in conception. It's called the intrauterine insemination, where the sperms of the father are injected into the mother at a time where she is in her fertile period. Okay. If the trial has failed, that means the mother will menstruate, and then you have to try it again. That is IUI. IVF runs by the similar philosophy, but in a different way, wherein the eggs from the mother's body are taken, the eggs from the father's body, the sperms from the father's body are taken, and they are fertilized outside, and then put it into the mother's body. Okay. Now these attempts also may fail at times, sadly, but people do try second and third time when something like this happens. Now, IUI, IVF, these are methods which have been working since years and are considered to be very safe and very helpful for people who want to have children. And then, of course, there is this concept like if there is issues with sperm, then there are sperm donors. There are egg donors also. All right, people who donate eggs, people who donate sperms in cases of complications with either of. And then there is surrogacy. Now that is under a lot of question mark in India as of now, and a lot of difficulties and complications are going on there. But surrogacy is one more thing. What is surrogacy? Where, let's say, if the mother is not able to hold the child, so the mother's eggs, father's sperms are combined, put it into a third person whose genetics are not going to come into the child. So that unborn child is planted in the third person, the surrogate mother. So that is one way of surrogacy. Another way of surrogacy is where she also becomes like the egg donor, where sperms are injected into her and she conceives. So then in that case, it's her biological child, but it's given away to the couple. So that kind. These are the different ways in which nature can need assistance. And other than that, when we are looking at anything related to conception, getting pregnant, please understand your lifestyle is very, very important. Your lifestyle, your mental, physical health, couple equation, financial readiness, things that I spoke about in the first session. It's all very important. So consider these factors. And I hope you found this whole thing very beneficial and helpful. And do like and share it if you think it was useful, and please comment also. So thank you so much.
Help Talks are daily health related talks held at Health Education Library for People, Mumbai, India. For more information visit www.healthlibrary.com. Subscribe to Help Talks channel. Be better informed about your health.